Okay, good morning, good afternoon, and good evening, everyone. Thank you for attending our RehApp 2.0 launch. We hope that it will be an insightful event for all of you. Before I hand over to Hype for the keynote, I would like to mention a few things. For those attending the launch via Zoom, you will automatically have been muted. Please remain like this throughout the course of the launch. This is to ensure that there will be no interruptions during the presentations. If you have any questions or comments during the presentation, during the event, feel free to put those in the chat box, and our colleague Ruli Volting will be collecting those and using them for the discussion period. Angelique Kester will be facilitating the discussion. For those of you attending via the YouTube live stream, it's the same principle. You can also add your comments and questions in the chat box. Please note that there will be a slight delay, so we apologize for this. If we cannot get to your questions during the launch and you still want some answers, then feel free to contact us after the event. Lastly, please note we have done our best to add subtitles to the recorded presentations. However, for the live speeches, we will not have live captioning available. However, this event will be recorded and we will make sure to add subtitles before the recording is uploaded on our website. So if you wish to view the launch with subtitles throughout, then you can be sure to watch that recording. Finally, as you have heard earlier via Zoom, the launch will be recorded. So if you do not want your video recorded, then please switch it off. And I will now hand over to Huib Cornelia, Enablement's Executive Director, for his keynote speech. Enjoy.
Leah, will you stop your share screening?
Yeah, if I find, yeah. Go ahead.
Thank you. Okay. Leah was already referring to the fact that during the live presentations, we don't have live captions, but I decided actually to put some extra text actually in the PowerPoint slide so that those of you who have difficulty hearing, you still will be able to follow actually the line of my presentation. A very warm welcome to all of you. I'm very excited about this development and about this event because it has taken a long time before we were able to launch actually the RehApp 2.0, so to say, and I will tell later more about this. And I hope that you enjoy this session, that you listen, learn from what we are sharing, what is being shared during this event, that you enjoy it, reflect actually upon all what has been said. There's time for discussion as well. And most importantly, I hope also that you will download the RehApp, that you share it actually with your staff within your organizations, and that the RehApp will be widely applied actually, because I think we didn't make the RehApp to have this nice launch, but we made the RehApp to make sure that it is really a tool that is can be used at your fingertips in order to empower other people. So enjoy. Now, just a little bit about enablement. Enablement, its interest is actually the development and innovation in community-based rehabilitation and disability-inclusive development. Enablement was established in 1999 in the Netherlands, and it is a non-profit company with currently 3 staff members, but also with a broad network of associate members who form an international team of committed disability and rehabilitation professionals from various academic fields. The mission of enablement, we strongly believe that CBR, and increasingly it is being referred to as community-based inclusive development, but I won't use this term, otherwise I have continuously referred to it, which makes it sometimes a bit difficult to listen to. So when I talk about CBR, you can fill out CBID as well. So we believe that CBR as a strategy for inclusion can only be effectively developed and implemented when field workers are trained to, with the right rehabilitation competencies, be agents of change, networkers, and creative problem solvers. We enhance reflective reasoning as the core learning principle in building capacity at different levels, and we contribute to the innovation of educational approaches, tools, and materials for anyone involved in CBR, from grassroots to top management level. Our objectives: we care about inclusion, and therefore our working principles are to contextualize CBR. CBR in the mountains of Nepal is very different from CBR in the flatlands of Nepal, and certainly very different from the extension of the Kalahari Desert, where some of you may be working. We accompany others in their advocacy. We pay a lot of attention to reflection as a means of learning and research. So we try, whatever we do, to try to find evidence actually for what we are doing. And we enable agents of change, because we do realize actually that in order to make sure that people with disabilities will be included in all domains in life, we need a system change. Now, at the end of this lounge session, I will say a few words of thanks also to some people, but I would like to start also with it. Otherwise, I may forget a couple of things. And first of all, a word of thanks to the donor organizations. Too many to mention at this moment, but a few I really would like to thank in particular, because they were actually quite special in terms of the involvement, but especially also in terms of the amounts of the contributions that have been provided to us. And first of all, I would like to mention Caritas Germany and their back donor BMZ, Light for the World Austria, the international organization, and the Austrian Development Agency, and the Liliane Foundation based in the Netherlands. I would like also to develop the large numbers of individuals and staff from various NGOs and INGOs, and I know that some of you who are listening at this moment did contribute to various chapters, for instance, chapters on club feet or on spinal cord injury, too many to name. So I'm going to not to name all the names, but you will find them actually in the RehApp. The acknowledgement will be there in the RehApp. Of course, the field workers who did test the app, who have been struggling sometimes with the first version, but who have been working also with this version of the app more recently. People with disabilities and their families who have been providing lots of input, lots of ideas as well. We felt it was very important actually that we get their ideas also about how they view not only the app, but also how they view actually what is currently being offered to them. The various universities and students who have been involved in this trajectory, and our app builder, Theo Weimer, who is currently also available from Pensar in Germany. I think it was very nice to work together with him for such a long and intensive time. And I think that's something which will be continued during the coming periods. Then our fantastic illustrators from Collateral Damage Studio in Singapore, far away from the Netherlands, but we have for years, we have a great relationship. We are sometimes very terrible to them because we very easily disagree with the paintings, the drawings they make. But in the end, I think we have high quality drawings. And last but not least, the staff from Enablement and Associates. We are really very, we came close to each other in this project, and I think we are almost more like friends than colleagues. So thanks to you all. Now, what is the RehApp and what is it not? Now, first of all, I would like to make it very clear. The RehApp is about rehabilitation in a broad sense, taking the ICF and the CBR matrix as its conceptual framework. It is thus not about rehabilitation in a narrow sense only. It includes that some people may call it medical rehabilitation, but it is only one part of it. Now, it is furthermore a tool that will help field workers and professionals to do their work better. It is a tool that informs and empowers people with disabilities. And it is thus not a miracle tool. It does not plan for you and it does not solve your problems, but it is a tool that helps you in solving your problems. Quickly about the history of the RehApp. It started already, the idea in the year 2015. We sat together as a team and we were realizing there's a shortage of good material actually for people working in the field. And when you start thinking about field workers, without doubt, the book Disabled Village Children comes up immediately. And we sat together and we were saying, you know, we need to develop a Disabled Village Children 2.0. It needs to be digitalized. We had discussions with David Werner about this as well, the author of Disabled Children, and he was saying, I'm too old to be involved, but please go ahead with this important development. In 2016, we had a student occupational therapy from the Netherlands doing an internship in Indonesia, and she gathered a lot of information about having a spinal cord injury in the situation in Indonesia. She made lots of photographs, and that was the onset of the first chapter of the old RehApp, chapter on spinal cord injury. Then in 2017, the first funds became available from Plan International, and we jointly worked actually on the first spinal cord injury chapter. 2018, the development was taking off. There was a CP chapter being developed, chapter on leprosy. More and more organizations became interested in what we were doing. And during that year, we received seed funding from 11 INCOs altogether. 2019, we did a lot of field testing. There were a lot of discussions about the app, and we realized actually that the app had to become more visual and more intuitive than it was. And that was, you could say, the start, the birth of RehApp 2.0. A big step forward in 2020 when Caritas Germany was funding the developments with very substantial funding. Leah will tell later more about the CMS that we have. But I think that the building of the CMF as the content management system in which our app builder had been very vital, has been a very important development. And then 2021, a continued development, translations, and Light for the World International has been very instrumental in this, because they had also an interest, and they still have an interest in rolling out the app in Mozambique, where the Mozambican government is working on the rolling out of CBR. Why the RehApp? Now we believe, and I think you probably will recognize this, there's a huge gap. Someone told me a while ago, it's an ocean, it's not a gap, it's an ocean between the needs of people with disabilities on one hand and the available resources on the other hand in many countries in the world. Now to specify that, we do see that rehabilitation resources, both human and material, are still scarce in low resource settings. Rehabilitation services in many countries are not well accessible, and if available, are often limited to the happy few living in the cities only. The situation in some countries is even getting worse than a couple of years ago. And we believe that it becomes because the interest of lots of organizations for the basic type of rehabilitation taking place in the communities is disappearing. And we still see a continuous brain drain and skill drain of rehabilitation staff. I think that's an ongoing challenge. And it is within countries that people are being promoted to higher positions, but it is also between countries that rehabilitation staff, Ethiopian physiotherapists, for instance, or Ghanaian therapists are working in the United States or in the United Kingdom. CBR, with its original focus on rehabilitation for all, slowly moved into CBID. And CBID, I would say, is more about mobilizing communities than about improving service delivery, according to at least some advocates of this change. Now, we believe that the quality of services remains poor, is still very poor, and urgently needs to be improved. And we believe that the RehApp can play an important role in this. RehApp 2030 was launched in the year 2017 by the World Health Organization, and we see that as a promising development. More attention for rehabilitation, but to a large extent also rehabilitation in that narrow sense. Still, we believe that RehApp 2.0 could become a very important and ideal tool, especially for those working in low resource settings. Now, then we have the recent report, the global report on assistive technology, the CATE initiative, which I think is very commendable and gives ample attention to the immense needs and importance of assistive technology. Within the RehApp 2.0, we pay already attention to assistive technology, not specifically, but as part actually of the different chapters. And we are intending actually to pay specific attention to it as well in a specific chapter. Now, you may ask yourself, but why did you move now from that initial RehApp into RehApp 2.0? Now, the old RehApp was a phone cap application, and that's a type of application that is rapidly not being used anymore. It's old-fashioned in a way. It's costly as well. And in that old app that we had developed, we were providing information only. So people were looking 1 time, 2 times, maybe 10 times at the app, and then they were not using it anymore. And we learned actually that if you want an app to be used, you must make sure actually that people see a need for that app. And then besides, the app was not very intuitive. The new app is based on progressive web application. Sorry for my voice. Take some water. I mentioned already the CMS, the content management system being built, which in the long run is much cheaper actually than a phone cap application. The app is still giving lots of information because there is a need for it. There's an urgent need for it. But on top of it, there's also a system in it to assess, to set goals, and decide on appropriate interventions. And there's a system to monitor progress, and there are ample opportunities to link also the information that is being gathered at the individual level to management information systems. Now you ask, most likely, because we have been asking this as well, can RehApp in its form contribute in solving the needs of people with disabilities? And we believe so, because I think with information technology, with all the opportunities that we have these days, I think information technology can serve in reaching the unreached. It can help in better informing people, and we feel that that the tool that we developed can truly contribute to changing situations. Maybe for your information, Mike Miles in 1989, in an article in Social Science and Medicine, was already referring to the importance and the opportunities with information-based rehabilitation for what he was calling by that time the third world. Our vision for the RehApp is that rehabilitation knowledge is accessible to people in the most remote places in the world. I will show you some of these places in a short moment. The goal and objectives of the app: we believe that field workers should be well equipped to adequately respond to the needs of people with disabilities and their families. The objectives: the RehApp is integrated in the daily work of field workers. As I mentioned already earlier, organizations involved in disability and development are strengthened with enhanced competencies of their workforce. If they use this app, that's what we believe. And people with disabilities have access to essential information about their own condition. The app is written in such a way that jargon has been avoided as much as possible and that it is easily understood. And if well, in a couple of years' time, can be read in whatever language you are thinking of. Now I show you some slides to show you the importance of good information here on these 2 pictures. One which I made a year ago in Ghana on the left side, and there you see the girl in blue, which is looking you with her beautiful eyes, which is called Elsa. Elsa is having cerebral palsy, athethoid. She is intelligent, but she is not able to speak and is not stimulated at all. Every day at the daycare center where she comes in Bujumbura, refugee camp of Liberian people, she is sitting there and she is getting the same puzzle and she is looking at the same children and she is sometimes seeing a physiotherapist, and that's all. Now, when I saw her that first time, I thought, why are people not paying attention to communication? We discussed that, I discussed it, and people were saying, yeah, we don't have the means, but a simple communication book can do so much actually to help Elsa to better develop. There's much more to say about this. I'm not going to do that. Then if you look at this small video clip.
I just apply from the Agaba system.
Now you probably see such type of exercises being done in many parts of the world, in Bangladesh, in Ghana, in Ethiopia. You see the type of wheelchairs in which a boy is sitting also in many parts of the world. Now, what I think is you see an example of poor sitting on one hand, but you see also that these range of motion, passive exercise in this situation are completely useless and even harmless. It is almost torture, you can say. Here on this picture, you see Peter, and Peter is lying there on a mattress. When he was found in Cameroon in a program from the Liliana Foundation, he was rolling over in the sand to move actually to a shady area. And after interventions, you see him now sitting in a nice chair. And this chair only, a simple chair, a simple assistive device, help people to go to school, attend church sermons, play and communicate with others. Now, this is the type of information, this is the type of thinking that CBR workers are often not being able to do well, not because they are not willing, not because they are stupid or whatever, but because they are not being trained for it or they don't have the means to think creatively. Now, the benefit of having an offline smartphone app is that you have your information at your fingertips instead of heavy books and manuals, which are usually not read at all, I must say immediately. You have easy updates with every interconnection. So it's an offline app, but at the moment you have interconnection, the app is automatically updating itself. So new information will be added when new information is available, of course. It's less paperwork. So if you use also the information part of it, there's less paperwork and less forms, and forms that an organization may use can be integrated into the app as well. So please connect with us if you're interested and we help you to sort this out. What it collects mainly is collecting information that serve actions in the field. Yeah. RehApp 2.0 can communicate with existing information systems of organizations and making it also a potential tool for information management. Now we see RehApp 2.0 as a basis, but we continue working on it, improving it, updating it. So continuous field testing will take place. We will be doing outcome studies. We are talking already with universities and other knowledge centers, and we are dreaming of an impact study. So I'm inviting those of you who are in academia to consult us as well. And we collaborate with other organizations to add new features or create new apps, such as a feature focusing on assistive technology and adaptive tools in agriculture, which is currently being developed. Now, these are the settings where RehApp will be used, and I go from the left to the right. It will be used in rural villages in Tanzania. It will be used in Nepal. It will be used in Kyrgyzstan. It will be used in Kalimantan, in the Longhouse, as you see there, in Indonesia. It will be used in Kano, in Nigeria. It will be used in Mumbai, in India. It will be used in Bangladesh, in the Chars, where 6 million people are living almost literally in the middle of the big rivers there. It will be used in Chad, and you can add to that. Now, some final words. It's actually two questions. Is everyone having access to essential and good quality rehabilitation? Now, I think for me, after visiting so many countries, it's very simple. No. Second question, is there still a very serious gap between needs, wants, demands on one hand and the supply of service on the other hand? And I think a very simple yes. Now, what is needed to make the no from the first question a yes and the yes a no? I think we should focus on delivering essential rehabilitation with limited and local available resources to as many people as possible. We should develop a model of rehabilitation and care that is appropriate and affordable for low resource settings. And the RehApp can play, in our view, a tremendously important role in making rehabilitation accessible. But it is, of course, not the only answer to all needs. More needs to be done. Now, what is furthermore needed? We think that we need to invest in the already existing mid-level rehabilitation workforce that is there in some countries, including also community volunteers, and build their capacity in becoming multifunctional and multi-skilled, become agents of change, become problem solvers, become out-of-the-box thinkers, and become liaison persons, resourceful persons. We need to ensure that they have the necessary competencies, and there the RehApp can play also a role. We need to give them the right tools and resources, and we need ultimately to get also government recognition. By far too long, the field of CBR and CBID is in the hands actually, or belongs to the domain of international NGOs, and it should become a responsibility of governments. Finally, a very big thank to all our donors, and to all our donors for making rehabilitation knowledge accessible to people in the most remote places in the world. Thank you very much.
Thank you, Hub, for kicking this off and sharing a bit about the history and the importance of the RehApp. I must apologize to our participants. For you who do not know me, my name is Léa Guignard. I'm the RehApp coordinator, so my apologies for not introducing myself. I would now like to continue. After Hub's keynote, I would like to show you a bit more about the actual RehApp 2.0 now and what it looks like and how it will be used. So again, for those of you who are just joining us, we have pre-recorded some of the presentations to ensure that there could be some captioning. For the live speeches, this will not be the case, but it will be present in the recording of the launch that we will be adding to our website. So I now turn your attention to the new RehApp 2.0. Oh, I'm sorry, I'm told there is no sound. Hold on. There is no sound, which is strange. There should be. My apology for the technical difficulty. Let me check again. Okay. Then I will do this again. Okay, if there is no sound, then I will ask my colleagues to let me know. As you know by now, my name is Léa Guignard, and I am the RehApp project coordinator. I have the pleasure of introducing to you today Enablement's RehApp 2.0. I will first play our demo to show you what it looks like, and then I will elaborate on certain items.
Community-based rehabilitation, CBR, or community-based inclusive development, CBID, is a strategy that aims to enhance the quality of life for people with disabilities and their families by meeting their basic needs and facilitating inclusion and participation in community life. Field workers form the backbone of the CBR-CBID strategy. They identify people with disabilities within the community as early as possible, assess their individual needs, abilities, and situation by reviewing the environmental barriers and facilitators they face. They work together with the person and family to develop rehabilitation goals and interventions, provide care and support, refer timely and appropriately, and work together with other stakeholders when needed and possible. The quality of these interventions depends to a large extent on a combination of generic problem-solving skills, counseling skills, community development skills, as well as basic knowledge and technical skills of the field worker. However, they generally have a basic educational background and often receive limited training to perform their job. The RehApp is a mobile rehabilitation application designed to provide information on a range of most prevalent disabilities, including physical, intellectual, and sensory impairments. It also allows its users to enter client information for monitoring. The different chapters on disability of the RehApp are organized according to the International Classification on Functioning, Disability and Health of the World Health Organization, WHO, commonly known as the ICF framework. This design simplifies use and ensures homogeneity between the chapters. The RehApp offers the field worker basic information on possible causes, signs, and symptoms related to a specific impairment. It also provides practical intervention options at personal and community level. The text is clarified with illustrations from a variety of ethnical backgrounds and religions, all of which can be enlarged. Chapters can be browsed through, or specific keywords searched for to get a list of suggested readings. Chapter sections can also be saved as favorites for easier access. Once logged in, users now have the possibility to enter client files. This section will guide field workers through the assessment, goal setting, and steps for action. In addition, the frequency of visits for a client or a specific goal can be selected, ensuring that each visit is automatically added to the agenda function. This will allow for regular monitoring and follow-up. This information can also be accessed via a computer for printing purposes, and the client file section can be connected to organizations' existing management systems upon request. The RehApp can be downloaded for free in the Google Play Store or Apple Store. Once downloaded, it can be used entirely offline to ensure that relevant and practical information is always at hand. The default language of all RehApp content is English, but content in other languages is frequently being added. The user can personalize the app by selecting their region and preferred language on the settings page. All client data and new content is automatically synced when the user is back online. Hard copy versions of all RehApp material can also be accessed and downloaded for free in various languages on the Enablement website.
As shown in the demo, the app targets field workers or service providers doing outreach work. People with a disability, such as children, youngsters, adults, or the elderly, are the indirect beneficiaries of the app. Our goal with the RehApp is to enhance field workers' capacity, not only by providing up-to-date information on various types of disabilities, but also helping them design relevant rehabilitation interventions thanks to the 2.0 version. The app is entirely free and accessible offline once downloaded, and it will notify its users of available updates upon connection. At the moment, 14 of the 22 expected chapters have been developed. The chapters highlighted in red in the release column still need to be field tested and improved. Those in the red expected column are being or have been drafted and are in the process of being given feedback on before they can be released for field testing. In developing these chapters, we rely on experts with international experience, but also university staff and students, staff from INGOs, organizations of people with disabilities themselves, and of course their families. This is entirely done on a voluntary basis. With the initial RehApp, uploading new content required hard coding, which is essentially a manual entry from the app builder, and resubmission of the application to the 2 app stores, which not only cost time, but also money. As such, we started developing new chapters in a flashcard format, which is a paper-based version, in order to ask feedback from peers, but also do field testing. After field testing, the content was revised, and only then was it uploaded into the app. This brings me to the developments of the last 2 years, during which we changed app builders in order to build a content management system, a CMS, and also redesign the app architecture based on our user feedback to include a lot of features to make the app more interactive. Thanks to the CMS, all the steps I mentioned during the flashcard process can now be directly carried out by our team, and also more importantly, can be done digitally. This means that new demo chapters can be released into the app as they are drafted and at no additional cost. The same is true for the translation of content into various languages. Of course, we will continue making these available in the flashcard format for those preferring a paper-based version. Finally, the CMS, as Hyde touched upon during his keynote, offers the possibility of developing additional application at no additional or less cost, depending on the complexity of the desired app. Such an example of a new app and feature is the milestone tracker, which is currently being uploaded into the CMS and which will be released very soon. Over the next 2 to 3 years, we plan on continuing to develop content and field testing it, as well as making it available in as many languages as possible. Improving the accessibility of the app is also another objective. Currently, our app builder is working on a text-to-speech function, which is almost ready. In the coming months, we will be sitting down with blind and visually impaired stakeholders in order to discuss how this functionality can be further refined, but also whether there is a need for a separate application with easier navigation for this functionality. We also wish to create a website dedicated to the RehApp with basic online training on the use of the app, as well as e-learning in order to dive deeper into certain topics related to disability, but also care. We hope to be able to set up a community of practice with an integrated chat function whereby users can exchange with one another about their experiences. All in all, the possibilities are endless. Finally, and perhaps most importantly, we wish to invest a lot more in research. For now, we have been relying mainly on user feedback and student projects in order to continue moving forward and make revisions. Ultimately, we wish to investigate outcome and later on the impact of the RehApp in the field and in the lives of people with disabilities and their families, as we believe that this is the next step in scaling up the RehApp and working towards its sustainability. Thanks a lot for your attention, and I look forward to your questions during the discussion.
Okay, then I think I would like now to introduce our next guest speaker, or our first guest speaker, and we will then move on to the discussion part. So our speaker will be Martin Jacobs. He will speak about the complementarity.
Do you know by now?
Oh, sorry. The complementarity of the RehApp with other systems. Martin works for HI as a tele-rehabilitation project manager, and he will be introducing their own innovation, Open Tele-Rehab.
Good morning, good afternoon, good evening. First of all, I would like to thank the team from Enablement for the invitation and also obviously congratulate them for the launch of the new RehApp. My name is Martin Jacobs. I'm working as a tele-rehabilitation project manager at Humanity and Inclusion, HR. Physical and functional rehabilitation as well as innovation have always been at the heart of HI's mission. Since 2016, HI has been researching and testing the use of emerging technologies in remote service provision, particularly for low and middle income countries and complex situations. Based on our findings, we are working on improving access to rehabilitation services through an innovative service delivery model that combines the existing delivery setup in a given context with the use of digital technologies. Let me first start by sharing with you how HI defines tele-rehabilitation. It is the use of information and communication technologies to provide rehabilitation services to people at a distance in their environments. We understand that tele-rehabilitation is a means and an opportunity to reduce healthcare-related costs for the users, to bring expertise closer to users in the community and promote continuity of care, to support efficient use of available human resources, to enhance data collection, reporting, analysis, and dissemination for rehabilitation programs. So all in all, a mean and an opportunity to support health system strengthening and universal health coverage. As a result, HI has developed an open source multidisciplinary telerehabilitation software called Open TeleRehab that I will present to you today. Open TeleRehab connects rehabilitation professionals with service users to improve access to rehabilitation services, facilitate discharge, transition of care, and follow-up. The software allows its users to access tailor-made rehabilitation treatment plans. It enables rehabilitation professionals to provide continued support and follow-up via chat or video communication. It includes plan adherence and goal achievement tracking. Open TeleRehab is made of 4 different platforms interacting together: an admin web portal to manage content, users, and system settings, a therapist web portal to manage patients' accounts, design treatment plans, set up appointments, and exchange with patients, a patient mobile app allowing patients to access treatment plans on and offline, provide feedbacks, request appointments, and exchange with the therapist via chat, audio, or video communication. And finally, an open access library web portal, allowing the rehabilitation community and the peers to access, contribute to a global telerehabilitation clinical library. Open TeleRehab is designed to become a digital public good. It is open source and its clinical content is open access for increased sustainability and impact. It provides culturally acceptable clinical content for relevant pathologies encountered in low and middle income countries and conflict situations. It answers to technological barriers with patient mobile app working under offline mode. It follows best practices in terms of data protection and security, and it features a multidisciplinary approach. I will now give you a very short overview of how the therapist web portal is working. So I will connect myself, as a therapist. And as you can see, the portal allows therapists to create patients' accounts and create and design treatment plans, including a goal achievement scale feature, exercises, as you can see, education material and questionnaires. It allows therapists to follow up on adherence and pain indicators. It allows therapists to review the results of questionnaires and goal trackings indicators. It also allows therapists to schedule appointments with their patients and to exchange with their patients using a chat, audio, or video communication feature. Open TeleRehab and the RehApp have great potential for complementarity. As said before, Open TeleRehab has been designed to connect rehabilitation professionals, so physiotherapists, occupational therapists, speech and language therapists, for example, and their patients. It comes as a complementary solution to traditional service provision. The RehApp has been designed for field workers in low and middle income countries, and it aims to enhance the capacity to work with people with disabilities within the community, assess their abilities and inabilities, design rehabilitation interventions, provide care and support, and refer appropriately. Just as rehabilitation services and community-based rehabilitation services can complement each other, Open TeleRehab and the RehApp have great potential for complementarity. The two systems can complement each other to ensure health information exchange between different levels of the health system, to improve discharge, referrals, continuity of care, and connection between the different levels of the health system, including referrals to secondary and tertiary levels and counter-referral from higher levels to the community, for example. And the two systems can complement each other by sharing clinical library content. Thank you for your attention.
Okay, I hope you have enjoyed both of these presentations, and I would now like to open it up for discussion. So any questions, comments you may have, and I will pass it on to Angelique and Ruli for the facilitation of the discussion.
Thank you, Leah, for giving us the floor. We have been working behind the scenes to follow up on live YouTube stream and the chats, both direct messages as well as general messages. So wherever possible, I will also try to answer the questions myself or address them to one of the speakers that already shared some of their experiences. Just the first one, maybe from Evan from Belize, who shared definitely the app will be used in Belize and the Caribbean region. So far, it has not been implemented there yet. So I was wondering, and I was chatting with him via direct message. So I'm not sure if it's possible to come online, but maybe a question for you, what would be needed for you to start in Belize and the Caribbean region? What would be needed for that? Can you perhaps share a little bit about that? And this was a question to, the name is Evan's iPad. I'm not sure if you can come online.
Okay.
Yes,
should
hello.
I? Yeah. Hello.
Yes, this is Evan Ko from Belize. I'm the CBR manager for a center. It's called the Inspiration Center. And I have looked at the app, and it will be extremely helpful for our field officers here. And I also belong to the Caribbean Disability Leaders on rehabilitation. It's all the countries in the Caribbean, and I have had the opportunity to visit most of these countries, and I am sure that this app is going to have an impact for persons with disabilities, their families, and it's going to make the work easier for the field officers as well. I don't see any of my colleagues, but I will definitely share this information with them, and then we can do a plan and see how we can move forward. Definitely, I will be contacting enablement to discuss our plans. One of the things that I realized when I downloaded the app is that our region is not included. You know, the Caribbean or I don't even see Central America like Nicaragua, El Salvador, so on. That was an observation that I had on this app, but it's extremely, I have looked at it, and I am very pleased I am to be able to access this app.
Yeah, thanks a lot, Evan, for your comments and questions. So maybe briefly to try and answer some of the points you raised. In terms of collaboration, for now, we've developed the app mainly for the countries where we have been working in, especially the languages we have available are mainly from previous collaborations from the initial app. Essentially, what we're aiming towards is to have it available in the world, wherever it's needed, wherever it's welcome. So if you're interested in having it being available for the Caribbean, it's not a problem at all. We're more than willing to discuss whether it's in need of translations, whether it's also about adding a region-specific item for that. So again, like I said, with the new CMS, the possibilities are endless. So if we know that there is an interest from your side, then we will definitely be very willing to work with you on making sure that the content is available in the languages that are needed, and also that you have a region-specific item so that you can customize the app a bit more. I don't know if that fully answers your question, and otherwise I will hand it back over to Andrew.
Yes, thank you very much.
You're welcome.
And I think if any field testing, we are prepared to participate in whatever field work testing we need to do. And then personally, I will contact you with a few suggestions that I have.
Great, thank you. Well, then I look forward to receiving your email.
Okay, thank you for sharing those views. And maybe to briefly explain, because Leah mentioned the CMS. The CMS is the content management system. So I always explain it maybe in a bit of a strange way, but I explain it as a very easy software like PowerPoint. You can make PowerPoints and you can add information in there and then it appears online. I worked in a CMS myself, the content management system, and it's very easy. I will get back to that because I see some questions popping up also on the management systems from Michiel Steenbeek, as well as from other persons asking about translation. So it will come back when we answer that question after this. Maybe there was a question, I posted it because we're communicating via different channels. So maybe I will just open up this question for Huip and Leah also here. There was a question about whether we have certificate of attendance for today's program. And I guess we of course can make something like that, but Leah, Huip.
Yeah, go for it.
Okay, I'm happy to respond to that. If there is a wish to do so, then we can make it available. I'm not sure how to organize it, but Leah, I'm sure we have all the email addresses of people, isn't it?
Sorry, yes, indeed. And if not, if you don't hear from us on that certificate and you would like one specifically, then I suggest the easiest thing you do is you email me directly. I will put back my email address in the chat maybe, and then you can send me an email and we'll make sure to get you a certificate.
Okay, Leah, put your email in the chat.
Perfect, thank you.
People know. Okay, for the other questions that were raised or comments that were made, I also want to Dr. Bumi, from CCMH Cambodia, who supports them, congratulates on the app. And just to explain, also thank you to Dr. Bumi because he was involved with the development of the chapter on autism spectrum disorder, which is online already, where we're making the last changes. If any changes, because constantly there are new developments, new languages, etc. So whenever your phone is in a Wi-Fi connection, it will upload the new changes. So it will appear on your phone as well. For Yogendra, I hope I pronounce it correctly. He shared something about the Nepali translation not being accurate yet. Maybe Leah, you can share a little bit about that because maybe that also has to do with Google Translate option.
Yes, thank you. Thank you for your question, Yogendra. That's a really good point. So maybe to explain a bit more about how the translation works for us, what we do is when we have partners interested in having a specific language or a dialect in the RehApp, then we work together on getting that translation ready and making sure it's accurate. However, when we start inputting translation of certain chapters, but not all of them, what happens is because the app is made available, for example, in Nepali, then whichever chapters have not been translated, these will be automatically translated by Google and it will say so at the top of your screen. So for example, in Nepali, we've added certain chapters with our colleague from Enablement Nepal, translations that have been checked by her and developed by her. And there are a few chapters, I think maybe autism is one, for instance, that has not yet been translated by them. And because the RehApp is already available in Nepali, then that chapter will be translated by Google and this will be shown in red at the top of your screen. I hope that answers your question.
Yeah, thank you, Leah.
You're welcome.
Thank you. I'm clear.
Great.
Great. And there were other questions about translations, like are there prescribed procedures to follow in order to ensure qualitative translations, or any chances of using the RehApp in Indian languages, especially in Hindi? So in addition to what Leah said, maybe you would like to share a little bit about that and about the easiness on having that short explanation that you gave me as well on how to use it.
Yeah, again, I'm happy to answer, but if anyone else from the team wants to, then feel free to jump in. Regarding Hindi, we actually have our colleague from Enablement Nepal who also speaks it and reads and writes it. So she is just getting started on some of the Hindi translations. But essentially, as I was saying earlier, if you have an interest, then please contact us to let us know. For the translations, we work in two ways. Sometimes we have partners who want it immediately and they have budget for it. So we can just send the material out to professional translation and have it done that way. And if not, when we work together with partners, then what we do is we have a few feedback or revision rounds just to make sure that from different perspectives, the material has been accurately translated.
Okay, thank you, Leah. Next question, and maybe for Huib or for Theo to also answer. Theo is the app builder. Michiel, if I don't phrase your question well enough, please feel free to unmute and add to what I'm saying. But Michiel Steenbeek from CDM is asking a bit more explanation on how the RehApp can communicate with management information systems. And he asked, do you mean with management information systems under the Ministry of Health in countries, for example?
Yeah, I find it a very challenging and important question you raise, Michiel. I'm not sure about that. This is something we need to develop. Theo is our technical guy, and I think he can give you probably more information about the technical part, but I think we don't have the time now for it. But in principle, the app is able to communicate with different systems. In practice, I think it is a matter of sitting together and trying to find out what type of information is needed and how can it become actually available actually to the different service providers. I'm not sure if I'm very clear actually with my answer, and otherwise, Theo, maybe you can explain a bit more in detail.
Well, okay, thank you very much, Huib and Angelique. Yeah, that's actually what I meant. I was made to understand during the presentation that apart from content management systems, the app can also easily be connected or communicate with management information systems. And I was immediately thinking about what is very current at the moment, that our programs need to enter their data under the Ministry of Health systems, so that everything that deals with disability and rehabilitation is also part and parcel of the country reporting in terms of data and people with disabilities and so on. So that is what I just wanted to find out, whether, because every country has a slightly different health management information system, and I was just wondering, that's not going to be an easy thing to get that communication from the RehApp into the Ministry of Health system. But yeah, that's what I was made to understand. Maybe wrong, but otherwise it would be very interesting and yeah, really very beneficial for all of us.
Yeah,
thank you.
Thanks again, Michiel, for this important question. I think it's something we have to work out the coming months, actually. I think it's much easier to work with an INCO and trying to make sure actually that the system communicates well with their system than to do that with government as well. There's, in a short time, there's a presentation coming from the Karuna Foundation. They work with almost 300 CBR workers in Nepal in a government-owned program. And I hope that that program will be the start actually of negotiations also with the government about incorporating actually the information that can be generated from this app in their system. We have Monday, we have a meeting with people from Bangladesh, and similarly, they have very good connection with government. And similarly, we are trying to see actually how can we make there the connections also. So this is just in an exploratory phase, so to say, but technically it is possible.
Okay, thank you, Huib. Thank you, Michiel. I would also like to give the floor to Theo for a moment. Maybe he wants to add something from the technical point of view.
Well, at the moment, I don't have much to add to what is already said. The only thing I can say that there will be an interface, so it is called technically, for the information for other systems. So other systems can connect to the server where all the information is kept, and that will be discussed in the coming month.
Okay, thank you, Theo.
Okay.
Theo has been our guiding light through this world of technical stuff, which we initially were not trained for, but learned a lot from him along the way. Let me check the chat. Thank you for all the kind messages. I see familiar names here also. I see a person from Somalia also sharing we have only 3 physical rehabilitation centers and there are really less rehabilitation workers. And the person is asking how they can start in Somalia with the RehApp 2.0. I've seen some more messages in the chat of persons not being able to find the RehApp in the Apple or Google store. Maybe Leah, we can address that later on, but I'm sure let us put that in a chat. When you are in the Google store or in the Apple Play Store, what title you need to fill in to find it. If you look above us, the background that we have, you need to look for the logo of enablement. This is the correct image that you need to see in the Google and Apple Store. So my advice would also be to download it first, browse around, scroll around, see what you think. If you have any questions, feel free to contact us. And if you feel it needs to be translated in Somali or something like that, you can also contact us because we can give you access to the content management system. And Leah will give you a very short explanation on how it works. And then you can enter the translation directly in the system. And this really saves time and is effective.
Yeah. If I can make one quick and small addition, if you go to our enablement website, so enablement.eu, on the tools page, you will have all the updated information about the RehApp, and there are the 2 buttons for the stores, the Google Play Store and the App Store. Yeah, I think that's what it's called. And if you click on those, then you will directly be brought to the page where you can download the app. And in any case, I will have the previous app removed from the stores as well, just to avoid any confusion. So very soon, if you look for RehApp in one of these stores, then this is the one that should show up.
Okay. Thank you, Leah. And if you look in the chat, and thank you, Fung. Nyen Fung Ha, she added the links, the direct links to the website and to the Android version and the iOS version. So you can have a look in the chat to see what how you can access it. Let me go up. That was for India.
Maybe I can ask one of the questions asked by Annette. When will there be e-learning available about the proper use of the app? So maybe Leah, you can say something about that one.
So now that the app is officially launched, that's next on my list. So I will make sure I've already done so for partners who have been using the app a little bit already, but I will create very shortly a simple e-learning just to help you navigate around the app, understand all the different features, functions. And later on, one of our wishes, as I said, is to develop a bit more extensive e-learning to also dive deeper into topics that cannot be addressed in an app format because it's quite content heavy. So there's definitely more to come, but we just need a bit more time to get everything started.
Can I just, in addition to what Leah has been saying, mention also for the person from Belize, that we have intensive contact actually with the CBR network in the Caribbean. And there has been a request already from the CBR network to give also a training actually in how to use the app. So I think the question coming from Annette from the Karuna Foundation is a question which comes also from other sources. So we definitely will pay a lot of attention to it the coming weeks.
Okay. Thank you, everyone, for your additions. Let me pose the last question because we have a new or another discussion moment later on in this launch. So maybe a last question, and this question is from Martin Jacobs from HI. And the question is that you ended your presentation saying that the RehApp and the Open Taylor RehApp can be complementary by sharing clinical library content. What does that mean and require in daily life practically?
Yes, thank you for the question. So as I said during the presentation, we have a platform that is an open access library that can host any kind of material and where anybody can contribute, add new material or review existing translation. And we would hope that this platform could become a central place for hosting relevant material. So we will do so with the content of the of Open Tele RehApp that we are very keen to share, and we hope that along the way other stakeholders will join. So that is what I can say from my end.
Okay, thank you, Martin. So it also stresses out that our message today is not only to speak about the RehApp 2.0 that's now online, but it's also about the importance of the connections to be made together, and that together we can strengthen even more each other's content. So I hope that we can have more collaborations and connections in the future. For now, I will give the floor back to Leah to go to our next moment on the program, and I will come back to the remaining questions in a short while. Thank you.
Great. Thanks a lot for your critical questions, and I hope that we'll have more of these in the next discussion round. Thanks also to those answering those questions and Martin as well. I would now like to turn your attention to some testimonials that we have received from 3 of our app users. So let me just close this. So I'm sorry, I will probably butcher it. Maybe Angelique, you can better pronounce Phuong's full name than I can, since you're a bit better at Vietnamese than I am. Angelique?
Sorry, that was really the question. This is Nguyen Phuong Ha. She's also here in the room. So if you have specific questions for her, she's also very willing to answer those.
Yes, thank you. So from Vietnam, then we also have Ndio Wawe Aaron. I'm sorry if I mispronounced your name. And Faustina, sorry, from Uganda. And Faustina Fabian Kimolo from Tanzania. So I will let you now listen to their experiences with the RehApp. Oh, sorry. Please let me know if you have sound this time.
Hello, my name is Phương Hà, and I like
yes, we have.
founder of the Association of Parents with Children with Cerebral Palsy in Vietnam, and I'm also a mother, a mom of the cerebral palsy daughter, my daughter, and because she had a severe mixed CP, and when I go to the hospital and everywhere that I can find, I receive many like refill, sector head to like refill her to the treatment, because they just said to me that they don't know what to do for her. So I try to learn, and I try to become a therapist for some way for my daughter, and after that I just open a center, very small center for the cerebral palsy children come and learn and play and have fun. So the reason that I want to open the center is my daughter first, and a few years ago, maybe over 5 years, I just organized a group. In the beginning, it's just online group for the parent, because I just want to share the knowledge for the parent. When I go outside and I found out that in my country there, like the information is not popular, especially for cerebral palsy, for CP. So I want have a group to share the knowledge for parent to parent, so they can have the power to support their children like more helpful, more useful. And with the app, the RehApp app, because I use the RehApp app version 1, and now I use the version 2. I just have some opinion like with the old version, I just use the app to introduce very basic about CP for parents. But now in the new version, there's some option, there's some advice, especially that like example like how can you have the children can hold something or learn something through the mirror or to supported a tool to hold and feeding and something. And this did a very strong part that I when I compare to our version, because you just like give more option, more advice in the new version. And also you put many picture now, and when you look at the visual out the overview, it's like more friendly, more friendly. And now the new version has a ton of knowledge, and I use this new version, the RehApp app. Now I use as the guideline, not only for the parent, but for the child that I working. Some parents who can like learn English, they can learn like what difficulty of their child, and they can choose the option and the advice from this new version to apply to the daily activities, and it will support the children most. So this very strong part of this app. And because I have the center, so I have a few children, and each children is unique. And when I see some problem of the child, and I want to explain to the parent that what it is and what happened and what option that we can help, we can support the child, I can use this app also. And I think that if I can request or I can ask in something new to adding to this app in the future, I want to like other language version, because we have we in Vietnam. I'm in Vietnam, and I want to Vietnamese version, and also in South Asia, we have Thailand, we have many countries. So maybe if we have all the version of language, this app maybe will be familiar to all the people, especially in the poor area, because they mostly they don't know English. And also I want to add some video to parent can like understand clearly what happened, and the video will be the best way to explain also the parent and the children, because I think that in family we have the children with special need, we surely the parent, and we have other siblings, so we can explain easy way to the children, the other children in the family. And if we can have some seed of development of the normal children, parent can compare, and parent can put the right target to their child. So maybe it will be very helpful more. So this is my sharing about this new version RehApp app. Thank you for listening.
Hello everyone, I'm Njoawe Aaron. I'm a pediatric occupational therapist, and I'm also a spina bifida and hydrocephalus interdisciplinary program coordinator for Western Uganda. I work with the Hours program. I'm here to share with you my experience with the RehApp app that I've been using since 2019. I started using the version 1 with the hard copies of the flashcards, and they helped me so much whenever I would be doing my community work of home visit follow-ups, because they gave me an opportunity to have all the resources at hand, so I could easily consult the flashcards such that I can get to know the set of activities I can do with the program's beneficiaries. Currently, I also have the version 2. And what I like about the second version is that more conditions have been added in. So if I'm doing my community activities, then I don't have to worry about conditions such as spina bifida, autism, burns, club feet, since I'll be having them on my phone and it can easily be accessed offline. And so I call upon everyone to get this application, download it, install it on your phones, and it can help you whenever you're doing your field activities. We hope that perhaps in the future there will be a provision of having in some short video clips about some conditions, about how they present and what you can do with them. Thank you very much. I wish you the best.
Hello, my name is Faustina Fabian. I'm a physiotherapist from Tanzania. I work with an organization called Community-Based Inclusive Development Organization, which supports children and youngsters with disability using the CBR approach. With the use of the first version of the RehApp, I was able to train the parents and field workers about the disability conditions in a very simple language and without using the medical terminologies. This has made my work become very easy because it was easy for them to understand the disability condition and also setting the SMART individual rehabilitation plan for the child with disability, hence coping with the rehabilitation plan that are made. Hence, this has reduced the frustration and also high expectations from the field workers, as well from the parents of children with disabilities, especially those with severe conditions like cerebral palsy. And I liked using the first version because it was written in a very simple language, and also it had pictures which I was using as demonstrations during the trainings of the parents and the field workers. For the second version, I will continue using it during the trainings of the parents, the field workers, and also the community members on different kinds of disabilities. So I would like for the second version of the RehApp for it to have more kinds of disabilities like muscular dystrophy and microcephalus and other kinds of disability that are complicated, and also for it to have different kinds of pictures that shows the kinds of disability and also the management of the conditions. Thank you.
Thanks a lot. I would like to thank Fong, Aaron, and Faustina for sharing your experiences with the RehApp, and I also look forward to hearing what you think of the RehApp 2.0 as you continue using it and as it continues to evolve. I would now like to introduce the next speaker. Sorry, having a technical difficulty.
Hello.
Yes. So our next speaker is Umeda Munavarova. Again, sorry for the pronunciation. Umeda is a CBR training coordinator from the Tajikistan branch of Caritas Germany. She has done her presentation in Russian, but as with other presentations, we have provided some English subtitles.
Здравствуйте, уважаемые коллеги! Позвольте выразить признательность разработчикам приложения RehApp за предоставленную возможность участвовать в процессе пилотирования данного приложения, а также за возможность выступить на данном мероприятии. Филиал Ассоциации Caritas Германия в Таджикистане работает с 2007 года. Начиная с 2010 года мы внедрили программу реабилитации на уровне общин в 6 регионах Таджикистана. В 2018 году мы внедрили программу реабилитации на уровне общин в соседней стране, в Кыргызстане. А с 2021 года мы начали внедрять программу РУО в Казахстане и Узбекистане. Таким образом, мы охватили программой РУО почти все страны Центральной Азии. Данная презентация содержит информацию о пилотировании приложения RehApp по ДЦП в пилотных регионах Caritas Германия в Таджикистане. Приложение RehApp было специально разработано организацией Enablement для полевых реабилитационных работников на уровне местных сообществ. Видение Enablement – сделать знания о реабилитации доступными для людей во всем мире, особенно в местах с ограниченными ресурсами. Цель разработки RehApp – хорошо подготовить полевых работников для удовлетворения самых насущных потребностей людей с инвалидностью. Какова актуальность данного проекта? В современном мире развитие страны зависит от развития информационно-коммуникационных технологий. Страны с развитыми ИК-технологиями продемонстрировали большую устойчивость во время глобального кризиса, связанного с пандемией COVID-19. Безусловно, COVID-19 стал толчком в области развития и внедрения цифровых технологий во всем мире. Таджикистан является одной из стран Центральной Азии с ограниченными ресурсами и населением в основном проживающим в сельской местности, где есть проблемы в сфере коммуникации и доступа к интернету. Но несмотря на это, для нашей страны развитие цифровизации с целью повышения качества социальных услуг является приоритетным направлением. Актуальность еще связана с тем, что ресурсы на реабилитацию, как известно, всегда ограничены, и наша страна не является исключением. Реабилитационные услуги в наших регионах, в регионах нашей страны недоступны или труднодоступны. Это связано с тем, что 93% территории нашей страны заняты горами. К тому же ситуация с доступом к реабилитации ухудшилась в связи с пандемией COVID-19. Мы наблюдаем также серьезную утечку мозгов и навыков реабилитационного персонала после завершения проектов и финансирования в наших пилотных районах. Кроме того, обученные полевые реабилитационные работники и родители детей с инвалидностью обычно не имеют возможности постоянно обучаться и обновлять свои знания и навыки. Поэтому мы приняли решение принять участие в пилотировании приложения RehApp в Таджикистане. Мы участвовали в пилотировании RehApp с самого начала данного процесса. В 2018 и 2019 году уже были разработаны и готовы к тестированию 8 глав, включая ДЦП, слабое зрение, ампутации, ожоги, травмы спинного мозга, проказа и косолапость. Для тестирования мы выбрали приложение по ДЦП и в 2019 году перевели эту главу на таджикский язык, следуя руководству по осуществлению перевода. В конце 2019 года и начале 2020 года мы приняли участие в пилотировании RehApp в Таджикистане. После пилотирования мы составили отчет о пилотировании и отправили его разработчикам в Enablement. Поскольку в 2021 году мы начали региональный проект по внедрению РУО, охватывающий страны Центральной Азии, мы перевели на русский язык главы, посвященные ДЦП и слабому зрению. И в 2022 году мы планируем загрузить главы RehApp на таджикском и русском языке на платформу RehApp и применить их в странах Центральной Азии. Как проходил процесс пилотирования в Таджикистане? Мы выбрали для пилотирования приложение по ДЦП и слабому зрению. И по рекомендации разработчиков было принято решение сначала протестировать RehApp в виде цветных напечатанных карточек. Для этого мы заранее перевели карточки на таджикский язык, распечатали, ламинировали и обеспечивали ими каждого участника процесса пилотирования. Вот так, в таком виде выглядел конечный продукт для пилотирования. И на основании полевым работникам предлагалось протестировать карточки RehApp в их обычной деятельности на местах и делать записи в предоставленных формах оценки. На основании анализа оценочных форм и рекомендаций полевых работников был предоставлен отчет в Enablement для дальнейшей оптимизации и адаптации приложения RehApp. Какова была цель пилотирования? повысить профессиональный потенциал полевых реабилитационных работников в процессе сопровождения людей с инвалидностью и членов их семей. Задачами пилотирования были предоставить отзывы о доступности и полезности содержания и удобстве применения карточек RehApp по ДЦП, оценить соотношение текста и карточек и картинок в карточках, оценить возможность интегрировать RehApp в повседневную работу полевых реабилитационных работников, укрепить потенциал организаций, занимающихся реабилитацией, путем повышения квалификации сотрудников. Период пилотирования в общем занял 5 месяцев, и пилотирование проходило в 3 регионах Таджикистана, которые были пилотными регионами Caritas Германия. И в пилотировании всего приняли участие 10 реабилитационных работников сообщества. Как проходил сам процесс более подробно? В начале, в 2019 году, это в ноябре, мы провели тренинг для отобранных полевых работников о целях и процедуре пилотирования, о том, как можно использовать карточки, как заполнять оценочные формы по пилотированию. И сам процесс пилотирования начался 15 ноября 2019 года. Для этого полевые реабилитационные работники должны были выбрать по 1-2 ребенка с ДЦП и в привычном режиме оказывать им услуги, при этом используя карточки ДЦП. Делать заметки в оценочных формах, делать записи о трудностях, которые возникли с использованием этих карточек. И в течение 3 месяцев они должны были постоянно использовать эти карточки. Мониторинг процесса пилотирования осуществлялся с сотрудниками Caritas Германия по телефону, а также с помощью ежемесячных собраний с полевыми работниками для обсуждения результатов пилотирования и для сбора данных о пилотировании. Таким образом, сам процесс пилотирования продолжился до февраля 2020 года, и сбор данных и анализ результатов с подготовкой отчета был завершен в марте 2020 года. На данном слайде вы можете видеть сам процесс обучения полевых работников. И для чего можно было использовать данные карточки? Карточки по ДЦП можно было использовать для того, чтобы дать информацию семье о нарушении, определить потребности ребенка и семьи, узнать о последствиях инвалидности для ребенка и семьи, провести оценку функциональных навыков ребенка, сформулировать цели вмешательства, выбрать виды вмешательства, использовать их в качестве руководства для ведения записей о ребенке и семье, использовать также карточки в качестве руководства для процесса мониторинга результата вмешательства. На данном слайде вы можете видеть сам процесс пилотирования карточек по ДЦП полевыми работниками. Вот некоторые отзывы реабилитационных работников о карточках RehApp. RehApp очень нужное приложение для полевых работников. Информация о ДЦП и картинки были очень полезны при работе с родителями. Карточки RehApp помогают дополнить знания полевых работников и родителей о ДЦП. Для качественной работы полевых работников данное приложение является одним из лучших рабочих инструментов. Все разделы RehApp информативные, полезные в процессе оказания реабилитационных услуг на дому. Мобильная версия могла быть бы более удобной как для полевых работников, так и для родителей, которые могут пользоваться ими самостоятельно. И в процессе пилотирования, как результат пилотирования, мы получили такие выводы. Во-первых, RehApp является необходимым и удобным инструментом для полевых работников. Карточки RehApp иллюстрированы картинками, которые можно использовать для работы с родителями. Карточки должны содержать больше картинок для удобства восприятия информации. Поиск информации в карточках облегчает цветовая маркировка каждого раздела. И это очень удобно. Там, где недоступен интернет, или там, где у семьи нет ресурсов, смартфона для того, чтобы скачать мобильное приложение, можно использовать напечатанные карточки, но для этого необходимы дополнительные ресурсы. Поэтому мобильная версия RehApp более удобна для использования, так как не требует вот этих средств на распечатку, и родители могут сами пользоваться приложением на своем телефоне. В заключение хочу отметить, почему приложение RehApp очень важное. Несмотря на то, что программа РУО внедряется в Таджикистане уже более 10 лет, до сих пор существует разрыв между потребностями людей с инвалидностью и их семей, и доступом к услугам и ресурсам. Приложение RehApp для мобильных устройств помогает решить следующие проблемы. Лучше проинформировать большое количество людей об инвалидности. Охватить услугами реабилитации всех неохваченных людей. Повысить профессиональный потенциал полевых работников. Лучше экипировать полевых работников для того, чтобы удовлетворять потребности людей с инвалидностью. Для большей информации вы можете обращаться к нам по электронной почте или посетить нашу страничку в Фейсбуке. Благодарю за внимание. До свидания.
Okay, from Central Asia, we now move to South Sudan, where Sophia Mohammed, the Light for the World Country Director of South Sudan, will briefly explain how they have made use of the RehApp in their program so far.
Good afternoon, everyone. My name is Sophia Mohammed. I'm the Country Director and Disability Inclusion Advisor for Light for the World South Sudan. Today, I will talk about the RehApp app. Light for the World South Sudan has been using this app for the last 4 years in our DICT or CBR programs. Our beneficiaries are CBR field workers, supervisors, and currently the disability inclusion facilitators. The reason why we pick this app is, one, it's very simple to use. The language is simple, and it has introductory part. It also talks about case management, and it also gives very good advice on good positioning and other factors for parents and the ICT workers. It's also unique because we can use it offline. As you know, in a country like South Sudan, power is a challenge. Not only electricity, but also internet access is also a problem, especially for people who live in rural areas. So this app can be downloaded and also be used offline. That's why our DICT workers are very comfortable to use it. Whenever they are in the field, they don't have to come back to us whenever there is a challenge. They just go back to their phone and refer to the app, and then check what is needed for that specific moment. So we are very grateful for enablement, for sharing this app to us, and I recommend for everyone to use it because it's a tool which can be used in our DICT programs, and it helps also for the on-the-job coaching. Everyone can orient him or herself using this app. Thank you so much.
And last but certainly not least with the presentations, I now take you to Nepal with Yogendra Giri, the Karuna Foundation Nepal Director, and Dr. Annette van den Hoek, the Karuna NL Director, who will tell you a little bit about how they plan to further integrate the RehApp into their program.
Ladies and gentlemen, good morning. Namaste from the Karuna Foundation Nepal. We would like to give you a brief introduction on the relevance of the Rehabilitation app for the Karuna Foundation Nepal. My name is Annette van den Hoek. I'm Director of Karuna NL Foundation, And the presentation will be given by Yogendra Giri. He is Director of Karuna Foundation, Nepal. Let me give you a brief introduction of the objectives, and afterwards Yogendra will take over. Well, the name of our program is Disability Prevention and Rehabilitation Program. This name is set by the government of Nepal since 2019, and you can see it as a follow-up of the Inspire to Care program, which some of you may know from the past. Well, what are the objectives? In fact, we have three objectives. One has to do with prevention of disabilities, the second with proper care and inclusion, and the third one with system strengthening. So the one about prevention is that we want to prevent as many as possible physical and mental disabilities in newborns and young children by providing proper prenatal and perinatal services to pregnant women. Our second objective is to improve the care and rehabilitation of children and adults with disabilities, both physical and mental. And the third objective is to strengthen the local care system and governance and develop inclusive communities. With the latter objective, we really hope to develop a program that can be continued by the government and local communities.
Thank you, Annette. Namaste to all the participants of this program. KFN has been collaborating with provincial and local governments to implement disability prevention and rehabilitation program in Province 1. There are 137 municipalities in Province 1, and we are working in 69 municipalities. Currently, we have reached 28,653 persons with disabilities. Municipalities take lead to implement the disability prevention and rehabilitation program, and the provincial government and Karuna Foundation Nepal provide technical and financial support to the municipalities. There are 231 community-based rehabilitation facilitators recruited from the municipalities to provide care and services to persons with disabilities. These facilitators are mainly responsible to identify the persons with disabilities, organizing disability screening camps, developing individual rehabilitation plans, and providing services based on the need for rehabilitation. We have aimed to enroll the disability prevention and rehabilitation program in the remaining 68 municipalities of Province 1, where around 25,000 persons with disabilities are living. We are in the process to develop hybrid training and resource center to provide knowledge and information to CBR officers and facilitators, professionals, and other stakeholders who are interested in implementing the disability prevention and rehabilitation program. We are also aiming to share our knowledge and experience with the municipalities outside the Province 1, and we have also dreamed to share our knowledge and experience with the countries that are interested to implement the disability prevention and rehabilitation program. You can see here the outline of the training and resource center of the disability prevention and rehabilitation program. We are in the process to develop this portal, and the RehApp application will be the part of it. We have envisioned that this portal will be very helpful to provide knowledge and information about the disability prevention and rehabilitation program to the interested parties. The RehApp app developed by Enablement will be very useful to our CBR officer and facilitators to access relevant information and skills, as it provides specific guidelines and knowledge about specific disability conditions. We are optimistic to work further with Enablement to assess the difference in diagnosis skills and quality of rehabilitation services before and after the use of the RehApp app. We have gone through the demo version of RehApp application, and we have found some recommendations for the Enablement team. They are: we request with Enablement to train our CBR officer about the use of this application. Later, these officers will train the CBR facilitators who are working at community level. We recommend using more quality pictures along with the measurement where applicable. We also recommend providing knowledge about more disability conditions like Parkinson's, arthritis, and muscular dystrophy. At the end of my presentation, I would like to share that the RehApp app will be very helpful to all the practitioners of CBR, as it helps to broaden knowledge and skill. I highly appreciate the efforts of the Enablement team for developing this app. Thank you.
Ladies and
Leah, we can't hear you.
Sorry, thank you. Thanks a lot to all of our speakers for sharing your experiences with the RehApp so far. I would now like to open it up once more for discussion, and I will hand it over to Angelique and Rui.
Okay, thank you, Leah. There are a lot of questions popping in, and we try to answer some along the way as people also needed to move to different meetings. One of them was again addressed on languages, sort of in general. One question was, in India, how will this app be used for all of us? Another person asked, why not in Bengali? So again, when you feel that you want to have something in your local language, please contact us and see how we can work together to get those translations in there, because it's quite easy to enter the translations, and we don't want Google Translate in the RehApp. One question was, will you be able to cover learning disabilities in the future? What we are working on now is finalizing the chapter on intellectual disability. So that is what we're finishing, and we had some discussions how to call it, and I think there were some different opinions about that, but the new version is coming. In the meantime, somebody likes writing on our page here, so I'm trying to remove the annotates in the meantime. So please try not to use the annotate function in this Zoom session. Martin also shared a link in the chats with a standard on interoperability between different systems in the healthcare industry. So interesting for people who are seeking to see if this can be sort of also be used to connect with government systems. So please have a look at that link in the chat. Ms. Leni Hoegen, she asked, can we share a short summary of key information on the RehApp 2.0 that people can use when they share the link on their website and WhatsApp? And maybe, Leah, you would like to answer that question.
Yeah, thanks a lot. Yeah, so now that we have the new demo ready, again, another thing on my to-do list, I will make a short, very short one-pager just with the main information, the key points you need to know. And I will be posting it on our enablement website as well. So keep an eye out. And I will also be sharing it with the network when it's ready so that you can communicate on this as well.
Okay, thank you, Leah. I also wanted to address that in the presentation of Ms. Fung, she requested for Vietnamese versions, and I just wanted to acknowledge also some people here in the session, because we have Vietnamese versions coming up for a few chapters thanks to VNAH, the Vietnam Assistance for the Handicapped organizations in Vietnam. So thank you for those translations, they're coming. Another question from Kenneth Nangai from Uganda. Can this version be used directly with a projector? And maybe, I think, Leah, I see you nodding, so I'll let you answer that one.
Yeah, so with a projector, I assume you mean then with a computer connection. This is definitely possible. The app can be accessed with a browser from a computer. You simply need to do something slightly technical, but not really, which is opening the developers tool. I can make a tutorial about this, and basically you just show it as a phone version on your browser. So if that's an interest of yours, then I will definitely make a tutorial and share this with you so that you can project it that way.
Okay, thank you. And the next question I would like to ask Aaron, maybe you can help answer this question from your experience. So Lindsay Gale is asking, what's the level of capability or training or experience needed to use the app? And Aaron, because you're one of the presenters with the testimonial, would you like to share a little bit about that?
Thank you very much, Angelique. Basically, the application can be used by anyone who understands basic English or has basic knowledge about disability. It doesn't have complicated terms, and another thing is that the ability to use a smartphone. If someone has an ability to use a smartphone, it can be used perfectly. So actually for us here, we are planning that even parents for children with long-term disabilities can actually install it on their phones for those ones who have smartphones, such that they can use the app. Thank you.
Okay, thank you very much, Aaron. And Lindsay, I hope that answered your question to some extent. Okay, then maybe a question from Eglal Shenouda from Egypt, if I'm not mistaken, from SETI. And also thank you to Eglal because they provided feedback on the autism spectrum disorder chapter. But the question was, and it's a question for Sophia Mohammed. I'm not sure if she's in this session or else maybe Leah can answer this question, help answer this question. There was a question about the testimonial or about the presentation. Is Sudan using an Arabic version or English or a version in local dialect?
I will first give a chance to Sophia to respond, but I don't know if she's in the Zoom event or via YouTube. Sophia, if you're here, could you speak up, please? Okay, then maybe I will answer this for her. As far as I'm aware, for now, they have been using the English one. But I do know that we have some translations underway, I believe, in Arabic. But again, like I said, for translated content, it's a bit depending on our partners and what languages they need. So it will be arriving along the way, but the priorities are set based on what our partners request.
Leah, I'm just reading that Marika Boersma is intending to answer as well.
Ah, perfect. Then go ahead, Marika, because maybe I don't have the full answer.
No, Leah, you answered it very nicely. I think in Juba they use an adapted version of Arabic. So an Arabic version, they call it Juba Arabic. So probably also an Arabic version might be difficult locally, and then they use local languages. So exactly, they use the English version at the moment. Thanks.
Thank you, Marika, and thank you, Leah. Question from, I'm trying to go fast through the questions, but it seems like more are popping up, but answers are also popping up, so that's good. A question from Annette van der Hoek. Do other organizations already measured the difference in the work of CBR workers before and after the use of the app? Huip, would you like to answer that question? Seems like a nice question for you.
Yeah, but I think it's pretty simple. I'm not aware of it. And it would be great actually if there will be an effort of organizations who are using the app to work together with knowledge institutes actually to do an outcome study and try to find out, is the app really going to make a difference in terms of the choices that people make, the decisions that people make, and is it thus helping actually people to do their work better? I think that would be fantastic. And we are looking for that type of research.
And maybe just a small addition, as Huip was saying, we are looking for that type of research, and we have actually been working on such a protocol. But for now, as I said, we have been relying mainly on field testing and student projects. So if any of you are interested in doing research on the outcome and later on the impact of the RehApp, then please do contact us because we are very eager.
Okay, thank you, Leah. Last question, because then we also already need to go towards the final statements. From Raymond Badou from the Salvation Army in Ghana. So I can imagine maybe Huip would like to answer this question as well. Can enablement support the Salvation Army CDR program in Ghana to integrate this app into our rehabilitation programs in areas of developing appropriate local languages to make the app more accessible to the ordinary persons with disability and their families?
Yeah, I think a very clear yes, we can support, but I would even bring it further. I think if we form a partnership, which we are forming already, I think it would be nice actually if you play an important role in terms of doing the translations, or at least funding the translations.
Okay, Thank you, Huip. And I think, yeah, there are a few messages from this meeting, including please contact us if you want to have local languages or want to support with new content that's not yet there. So thank you for all your questions. I think I will wrap up the discussion now and give the floor back to Leah.
Great, thanks a lot, Angelique. And thank you all for your input, and we hope to be continuing this discussion via email or otherwise. For now, I would like to introduce to you Alarcos Cieza. I'm not entirely sure of the pronunciation, again, apologies. WHO's unit head for the Sensory Functions, Disability and Rehabilitation Department of Non-Communicable Diseases, for some final remarks. Alarcos, the floor is to you.
Yeah, thank you, Leah, and thank you to everyone. It has been fascinating listening for the last hour that I was here to all the testimonials. So thank you for that. And look, for finalizing this meeting, I only come with three messages, and then I allow me to give also some recommendations. And look, the first message, and actually I would like to summarize these three messages with 3 words. The first word is congratulations, and I will elaborate in each of them. The second one is need, and I will also elaborate in that. And the third one is innovation. And regarding congratulations, look, I want really to congratulate enablement, but also everyone who has contributed to RehApp. It has been a tremendous amount of effort, a lot of knowledge, a lot of work, a lot of passion has gone into this product. And at the end of the day, I'm very much aware that it is about the commitment of individuals, what make things happen. So really congratulations to every single person that have contributed to it, but also to the organization, because also requires the commitments from organizations to move these kind of things forward. And it has been enablement, but it has been also other organizations behind moving this forward. The second word was need, and I think behind why need, because I think this is the word that summarizes the significance also of RehApp. Look, at WHO, we always say, and we launched 2 years ago, the estimates on the global need for rehabilitation. And we say 2.4 billion people around the world have health conditions that could benefit from rehabilitation. The tragedy is, however, that we know that not even 50% of those who could benefit have access to those services. And the tragedy becomes even more acute when we think that that unmet need is at worst in those low-income settings and low-income communities. And I think that is also the value of RehApp, that is really coming to address this unmet need on the poorest among the poor, and that is local communities that have not access to absolutely any services. So so I think it is important to recognize that. And the third one is innovation, because of course I think it is it has been, a lot of thought has been put into using innovation, and I think in a very healthy way, because it is not innovation for the sake of innovation. It is really innovation in a way that can be used, and that is also the significance. You know, it can be used by community workers in an easy way, and also by families and others that have access to the resource again, not innovation by innovation, but in a meaningful way. So these were the congratulations really need and the leverage of innovation in that way. So let me go very briefly to the recommendations, and I take the freedom of providing some recommendations. And I would like to summarize again in 3 words. And the first one is monitoring, collaboration, and then development. And in terms of collaboration, in terms of monitoring, please monitor the work that it is done, also based and with the support on the app, but also monitor the impact. The reality of rehabilitation and the reason for the whole unmet need is that rehabilitation does not count really, but it is also because we don't make it count, because we don't monitor the work we do. So that is my recommendation. I know that is in the mind of the developers, it is in the mind of potentially some implementers, but I think it is not something that can be led to the default option. It's something that needs to be harnessed explicitly and not implicitly in order for it to happen. Otherwise, we tend to forget it. So in terms of collaboration, look, it was very inspiring to hear some examples of really initiatives that are also implementing the app that are really coordinating and collaborating with local and provincial governments. And I think whatever can be done using RehApp to also harness that and strengthen that, so that we don't create parallel systems, that we don't create disintegration. And I don't know if there would be a way to make that message visible also in RehApp, because again, rehabilitation does not count if we do it in a parallel system and completely disintegrating. So harness that collaboration during the implementation. And then the development, because it was coming also from the users, many recommendations of further development, that it is very meaningful. And I would like to bring here also the further development in the future, not only from the perspective of the users, that is fundamental, but also further development in the context of other global initiatives that are also happening, so that really something like RehApp and with the potential with like RehApp does not happen in isolation. So some of you will know probably that also WHO in the context of the Rehabilitation 2030 initiative is developing many technical products, also a package of rehabilitation interventions with evidence-based intervention, also a basic package of rehabilitation interventions that it will come also with basic interventions to be provided at community setting and in low-income settings. And it would be fantastic if there will be some coordination and further development of RehApp, taking into consideration these also global initiatives, again, so that we make rehabilitation count, that we join forces, and we give the message also to policymakers, whatever the level of the policymakers, whether it is at local, community, regional, or global level, give the message that we work in a coordinating manner. So that is for me now. I go back to my first work saying congratulations again, and yeah, all the best for the further implementation.
Thanks a lot, Elarkos, for your reflection and also your recommendations. I think in terms of thinking, we quite align, but I look forward to seeing how this comes to life in the future. I would like to thank all of you again, and I will now hand it over to Hype Cornelia for some very final words before we finish this session. Thanks a lot. Hype, over to you.
Yes. Yeah. Am I online? It seems so, eh? Yes. Thanks a lot, Elarkos, for your very kind and wise words that you gave us, emphasizing the importance of the unmet needs. I think in that sense, I think we have the same needs in mind, actually, especially the needs of people in low resource settings. That is our drive, that's our passion. And thanks also for your very valuable recommendations. I think I like them very much. Seeking also where can we find synchronization of efforts and find harmony. Yes, we have come to the end of the launch of the RehApp. It has been a long journey, which is not yet finished. However, we are very thankful for this milestone. After all the challenges and even barriers that we faced, we are back on track. I and we as a team hope that the slow but steady progress which we made over the years will be paying out in an increasing number of users of the RehApp. While we always had hoped that this development would be supported by international organizations, and it is being supported by a large number of international organizations, we now realize increasingly also that it is extremely important to get support from governments as well. And I mentioned already earlier that we have good hope that in Nepal we can have discussions about the further rolling out of the RehApp. Discussions are taking place in other countries as well. At the beginning of this week, Leah and I had a discussion with the director of the African Disability Forum, Swaap Chalken, who is currently in the Netherlands, who told us that development cooperation and/or aid constitutes of less than 1% of the GNP of the African continent. Interestingly, but a bit by the way, he was saying we are not so interested in that 1% as people with disabilities. We are interested in being part of that 99%. And I think he's, of course, 100% right. The contribution, though, of this sector in the field of disability and development is even more marginal. In order to make a lasting change, we thus need to focus on a buy-in from governments. Today, you heard how a small organization such as the Karuna Foundation has been able to develop a model of healthcare, primary healthcare, and rehabilitation that now is being rolled out in one of the 7 provinces in Nepal. In the midst of this development, the RehApp has been introduced, and we are eager to see how ultimately the government of Nepal rolls out CBR, and in the slipstream, of course, also uses the RehApp in the entire country. And Elarkos was referring to monitoring. We are talking already about research, outcome research, and even impact research. So we do realize also that we need to come up with the facts. That it is not just having a nice app, which is more visual, which is more intuitive, which can be used in the own languages, but it needs facts. Similar developments are taking place in Mozambique in our relationship with Light for the World in Mozambique, and the government, after years of lobbying, the government is moving also in more pilots in different provinces, and the RehApp becomes then also an important tool. And soon we will sit together also with a government in a large Asian country to discuss and advocate for the introduction of the RehApp as well. As such, we can state that the journey has just started, an exciting journey that it has been for now almost 7 years. I would like to thank again for being with us, all of you, for being with us, for supporting us in various ways. I once again would like to thank all donor organizations. Without your support, the journey would have been much longer and much more difficult. I would like to thank the so many volunteers who helped in writing the various disability chapters, who were critical of each other and helped us time and again to go back to the drawing table and make sure that what we included in the RehApp was based on evidence and the best possible quality. Thanks to all the contributors of today, your input has been very valuable, and we felt privileged and honored that you wanted to be part of this event. Thanks to Leah in particular for managing this mammoth project, and for Angelique and Rudy for your professional contributions, for asking challenging questions, but also for your friendship. Finally, I would like to wish you a great day, stay well, and keep in touch with us. Do write us, do call us, and we will respond to you. Have a nice day. All the best.